Keith, you were a surgeon for 43 years. What do you think about the advancements of medical technology?
I was practicing medicine for 43 years. However, I had two specialties. I was an anesthesiologist first, then I went and took OBGYN and was a surgeon, and then I went back to anesthesiology. So my years in the operating room were about 43 years, and actually doing surgery was, as a surgeon, was for about 12 years. Anyway, the greatest advance in medical technology that I've experienced has been in anesthesia. Back in the old days, we had open drop ether and chloroform, and we just poured until the person turned blue, and then we stopped, and then we waited till they were breathing again, and their color was good. We had no instruments. Now we can monitor what the brain is doing, what the heart is doing, what the blood pressure is doing, what the respiration is doing. And so the advancement in anesthesia has been astounding, really. And things that we used to really have to fly by the seat of our pants, now we have instruments to take care of all of it. As far as the advancement in medicine, of course, there have been a lot of them. But I have to say, and I probably shouldn't say this out loud, but I am a little bit disappointed in the way the practice of medicine is going nowadays. It seems like, first of all, the medical profession is completely controlled by insurance companies. And the reason it happened is because we as physicians allowed it to happen, but it's unfortunate. I actually did surgery on a lady, and Medicare called me and said, this lady has to go home today. I said, she's not ready to go home. She's just, even though her surgery date was 3 days ago, she's not ready to go home. Lady on the other end said she has to go home. I said, okay, I'll have her at the door of the hospital. You swing by when you get off work and pick her up and take her home with you. And she said, I can't do that. And I said, well, where's she going to go? I can't just put her out on the street. That was the end of that discussion, and she stayed for 2 more days. Anyway, as far as the advancement of medicine, I think we've come a long way. But I think in the process of technology, we have lost the art of medicine, where the doctor and the patient become friends, where the patient relies on the doctor, and it is truly a time when you listen to the patient, you treat them according to them, not according to laboratory results or what the computer tells us. And that, in simple, would be my answer.